Hamburg. So this is my remote studio. They put me to work anyway. I took the night off and I'm still working, but it's a pleasure to be in this studio with you. Good to see you again, and congratulations.
Well, thank you.
You know, welcome back to NIAM. This institution means an awful lot to you, and your reputation precedes you. Few leaders in public health and medicine share the depth and breadth of your experiences, and we're really honored to have you here tonight. I need a teleprompter like I normally have, you know? So how does it feel to be back here and continue the legacy of NIAM?
Well, it is great to be back here and to be here with so many friends and colleagues and new friends as well. But certainly throughout my tenure as New York City Health Commissioner, the New York Academy of Medicine was a critical partner working together on pressing challenges for the city and providing expertise and support in key arenas to help us in the health department advance our issues. And I'd like to think that we also helped the New York Academy of Medicine, because New York Academy of Medicine plays a vital role in generating the evidence needed for good decision making. And so we could identify critical gaps in knowledge that would have impact on our ability to put in place the right policies and programs. And then New York Academy of Medicine could work with us to help us uncover the information we needed to be able to do the right thing. And I think that it was really a critical era in terms of the recognition of the importance of urban health per se, the particular challenges that can emerge in a place like New York City, and also the recognition that solving health problems was more than just addressing the issue of health care, but thinking about all of the determinants of health, the factors that influence health and well-being.
And the barriers.
And the barriers.
Right, right. And you know, your legacy here, your dad was a trustee, right?
He was.
Take us back. And
he was honored in, I think, 1997 or something. And my mother was also involved. It has been a family affair.
That is fantastic. And it feels great to be back here where your parents laid roots, right?
Yeah.
Yeah.
Absolutely.
And so NIAM, as you well know, has a unique way of influencing the careers of many health professionals and has been a part of the fabric of public health here in New York City for almost 2 centuries now. And you've played a significant role in building health in New York City as Commissioner of the Department of Health. Explain what you're most proud of from your commissioner days.
From my commissioner days. Well, I think, one of the things I'm most proud of was really being able to raise the visibility of public health issues in the city, to really explain more clearly what public health was, why it was important, why it needed to be supported, why it mattered to everyone each and every day. And I think, I did, Dave mentioned that I came into the role during a period of some challenge. It wasn't quite as difficult, I think, as the global COVID pandemic, but many pressing issues. It was the early days of HIV/AIDS. We were faced with a very serious resurgence of tuberculosis and drug-resistant tuberculosis, partly related to HIV/AIDS and partly related, frankly, to neglect. Many other problems as well, infant mortality, a range of infectious disease threats, both homegrown and imported, because of New York being a hub for international travel and commerce. And also, people forget, but I was health commissioner the first time the World Trade Center was bombed, and that was not an insignificant event. And for me, it opened up my eyes to the fact that as the chief health officer for the city, I also needed to protect against deliberate threats And, we started to think about a whole range of vulnerabilities that I'd never been trained in and had never thought about.
You learned on the job, if you will.
And learned on the job. And so I'm really pleased that we, I think, during my tenure, really helped to restore the stature of the health department and to renew an appreciation for the importance of public health.
I want to go off script a little bit. Does it surprise you where we are today with maternal mortality compared to when you were a commissioner? It was shameful then, and it's shameful now. What needs to happen to move the needle?
Well, I was so delighted to hear about the program underway with leadership from the New York Academy of Medicine, but it is shocking. It's shocking across the country where we are with maternal mortality, given the tools we have to address it, some of the basics of just fundamental ongoing care, but also, more sophisticated tools for intervention when needed. And I think, sadly, it reflects a certain arrogance. It reflects a lack.
What do you mean by that, arrogance, when it comes to maternal mortality? How does arrogance play into that?
Well, I think that we viewed it as a problem of the past. We weren't paying attention. We took our eye off the ball in terms of in fact, where our city and our nation were going with respect to maternal mortality. And I think, unfortunately, the problem was there, but it I think was important to actually document the problem in visible ways with solid data in order for people to really start to galvanize and say, this is a problem that we shouldn't be having, especially a country as rich as ours, and with the kind of medical and health resources that we have. We simply can and must do better.
As you said, you were front and center during the city's HIV epidemic, and now let's fast forward to 2020 when you saw how the health department dealt with the COVID pandemic. What did you make of the health department's response?
Well, I think it was just an unbelievably challenging moment in time. I was stunned by how hard it was to communicate clearly about what needed to be done and why. It's always a challenge in public health as something is unfolding to be able to both reassure the public but not overpromise, to be able to say, this is what we're doing now and why we're doing it, but to acknowledge that there's still more to learn. This is what we're doing to learn more, and as we learn more, our recommendations will change. But frankly, the current media environment makes it hard with 24-hour cable and social media. It's hard to stay in front of a message, and all of the misinformation and disinformation, and then the context politically in which this epidemic and ultimately global pandemic unfolded made it even harder because of the divisiveness of our politics and really a toxic environment in many places.
And more than 1 million Americans died of COVID.
Absolutely.
To this day, that is absolutely shocking.
And it's shocking to me that despite that terrible burden of death, illness, and disability associated with COVID, despite the incredible dislocations in our social lives, the damage to our economies and economic productivity, that we now are really just many people wanting to put it in the rearview mirror and move on, and we are failing to fully act on lessons learned. We're failing to put in place all that's needed to be better prepared next time. And the one thing I think public health is working hard to do is to restore trust which is going to be essential to future responses. But there's a lot more work that needs to be done, and I hope that we, as a community and a society, a country and a globe, will, really recommit to what needs to be done, because we simply cannot afford to keep repeating these
Right.
cycles of panic followed by neglect.
Yeah, and you mentioned lessons learned, and that leads to my last question. What do you, in your view, as a veteran health professional, what deserves our collective attention the most right now? And there are so many issues.
Well, there are so many
Yeah.
competing priorities, and
Exactly.
these are complex, challenging times. I mean, I think, sort of building on my various experiences, I think, we really have an obligation to both apply what we know that relates to maternal mortality, but so many other issues. And we have an obligation to continue to take advantage of all of the opportunities in science and technology today to improve our tools to manage health and also treat disease. So I think, that we really have huge opportunities before us. I think we need to be anticipating issues like the impact of climate change in health, as Ann Kurth was noting. And we need to be working hard across disciplines and sectors and borders to address these pressing global challenges before
And I'm
us.
just going to throw this in. What do you want everyone to know about this historic institution, since both of your parents were such an important part of it?
Well, I think it's more than the role my parents played. It's the role that this institution has played for now more than 175 years.
Yeah.
And it really has been a fixture committed to advancing knowledge in service of health care and society. And we need that more than ever. And I think that it is a reminder about the importance of having institutions that are driven by a sense of commitment, a sense of passion, and a sense of mission to make both the community and the city and ultimately beyond safer, healthier, and better for all.
Well, it's a pleasure to speak to you, Dr. Margaret Hamburg. It's such an honor.
Thank you.
Thank you. Great.